Welcome to Pacific Sleep Program. My name is Dr. Braden, and I'm the medical director at Pacific Sleep Program. Today, we would like to give you an introduction to the different types of masks that are available for use with positive airway pressure. You'll be working with our team of experienced sleep technologists who are here to help guide you through the process, answer your questions, and make sure you find the right fit and setup for your needs. They're truly the heart of our program and will support you every step of the way. If you are new to positive airway pressure, you may be thinking, I could never sleep with a mask on. This is a common response from people when they hear about or see CPAP masks. However, the majority of patients who use PAP therapy are surprised at how they are able to get accustomed to the PAP masks and get benefit from using PAP therapy. Starting PAP therapy can feel a bit like when a child first gets glasses. At first, the sensation on the face is unfamiliar. After all, our faces are very sensitive. Many children instinctively try to take their glasses off. But with time, they adjust so well that they can forget they're even wearing them, sometimes even looking for their glasses while they're still on. In the same way, getting used to a CPAP mask takes a little patience and the right fit, but most people adjust surprisingly well. Stick with it. You might be amazed at how natural it starts to feel and how much better you can sleep and feel overall. A person should be prepared that the first mask you may try, either in the lab or at home, may not be the right one at home. Research shows that it may take several masks to find the right one for each person. We also know from research that if a person gets one mask, tries it at home, and it doesn't work, the success of CPAP therapy is much lower than if they have close follow up with good mask fitting and adjustment, especially within the first 30 days of treatment. So it's important to work with your durable medical equipment company if your mask interface is not working for you after it is dispensed to you. Most mask manufacturers have a free 30-day exchange policy, so you will want to let your dispensing company know within the first 30 days. Outside of that window, you may have to wait 6 months for your insurance to pay for a different style of mask or pay out of pocket. So, with that, let's talk about the different types of masks. There are hundreds of masks available, but there are four main types of masks that are available, and there are pros and cons to each style. The four different types are nasal pillow masks, nasal masks, traditional full face masks, and minimal contact full face masks. There are also some masks that are combinations of styles. I'll be showing you some examples of each type and discussing some pros and cons of each type. First, let's start with nasal pillow masks. Nasal pillow masks are masks that have inserts that fit into the nostrils. Some examples of these would include the AirFit P10, the AirFit P30i, and the DreamWear nasal mask with the pillow insert. The AirFit P30i style and the DreamWear nasal mask come from the top of the head, while the AirFit P10 comes from the front. There are other nasal pillow styles as well. The nice thing that many people like about nasal pillow masks is that they anchor in the nose and tend to be a smaller style of mask. Many people like to consider nasal pillow masks. However, there are a few downsides which may occur for some people. Some people find that nasal pillows have to be exactly the right size, and many people find that they are not quite exactly the size that the manufacturer makes, for example, small, medium, or large, and as such, motion from side to side can cause leak. Some people find the nasal pillow irritating to the nostrils over time. Also, if a person opens their mouth with a nasal pillow mask, they will need to wear a chin band to keep the mouth closed in order to keep the treatment air that is being used to treat the apnea from escaping out of the mouth. Now, let's talk about nasal masks. Nasal masks have cushions that can either go over or under the nose. Over the nose examples include the Eson 2 and the Wisp. Some examples of the under the nose style would include the Solo, the Evora Nasal, the Dreamwear Nasal, and the AirFit N30i, as well as the new Memory Foam AirTouch N30i. The nice thing that many people like about nasal masks is that they tend to be a smaller style of mask. However, again, there are a few downsides which may occur for some people. Again, some people find that fit is an issue or motion from side to side can cause leak. Also, if a person opens their mouth with a nasal pillow mask, they will need to wear a chin band to keep the mouth closed in order to keep the treatment air that is being used to treat the apnea from escaping out of the mouth. Traditional full face masks are typically triangular in shape and go over the nose and mouth. Some examples of these masks include the AirFit F20, the Simplus, the Vitera, the Mirage Quattro, as well as the newer memory foam AirTouch F20. These masks are very all-purpose masks. These can be used in patients who breathe predominantly through nose or nose and mouth. By covering the mouth, the person can relax their jaw and still get therapy during the night. However, fit can be an issue depending on the person. The nasal bridge can be narrow or wide, and depending on the person and brand, there can be small air leaks near the nasal bridge into the eyes for some people. Also, as the jaw relaxes in different stages of sleep, there can be differing levels of fit by the chin depending on the size of the mask, which can introduce leak. So, sizing is especially key. The newest evolution of full face masks is called the minimal contact full face masks. These masks go under the nose, like a newer nasal mask, but go over the mouth. By avoiding the fit issues by the nasal bridge, these masks can fit a wider group of people and have a smaller profile. This style of mask has grown significantly in popularity over the past 5 years and is often the mask style of choice in patients who have breathing through their mouth and nose during the night. Examples of the minimal contact full face masks include the Evora Full Face, the AirFit F30i, the DreamWear Full Face Mask, the AirFit F40, and the new AirFit X30i, which is a combination with nasal pillows. As mentioned earlier, these can be used in patients who breathe predominantly through nose or nose and mouth. By covering the mouth, the person can relax their jaw and still get therapy during the night. However, as with all masks, fit can be an issue depending on the person. Depending on the person and brand, there can be small air leaks near the nose or cheeks. Also, as some of these have a very small profile, not all of them are large enough to contain the jaw and mouth when they drop open in different stages of sleep, particularly REM sleep. This can cause leak during the night and sometimes requires the use of a chin band, even though this is a full face mask. Let's talk a bit about chin bands. Chin bands, as mentioned earlier, are used to keep the mouth closed when using a nasal mask if the mouth drops open during certain stages of sleep, or if the jaw drops significantly when using a full face mask, causing high leak issues. The clinical term for mouth opening is called oral leak. While chin bands can be effective for some forms of oral leak, they are not effective for pursed lip oral venting. This is where the mouth is not fully opening, but the lips are pursed open, causing air leak and loss of pressure. Mouth taping, despite being a TikTok trend, is not recommended by the American Academy of Sleep Medicine as it is not FDA approved, and some studies show that it may increase the risk of aspiration or choking during the night, and it can worsen obstructive sleep apnea in some people. Chin bands come in different designs and styles. The four standard chin bands include the white Respironics chin band, the black Respironics chin band, the RubyCare Fusion chin band, and the tan adjustable chin band. Although we may refer to them by their colors, each one has a slightly different design. The white Respironics chin band is simply a white elastic band. This can be used to keep the jaw from dropping if there is not too much drop going on, or in combination with a full face mask. The black Respironics chin band has a chin cup and another band around the back of the head. It is more secure than the white chin band. The RubyCare Fusion chin band is a neoprene material that does not cover the ear. It has a couple of different points to Velcro. It is also a bit more secure. The tan adjustable chin band is often used for larger heads. It is similar to the RubyCare Fusion and is also sturdier and a bit more secure. One special consideration for some patients is facial hair, such as mustaches or beards. Depending on the shape and position of the mask and the placement of the facial hair, leak levels of a mask may change. Some patients find that keeping their beard or mustache trimmed is helpful to maintain a better seal on their CPAP mask. Another consideration is long hair. If you have long hair, using a ponytail and wearing it higher above the low set of straps is often the most comfortable way to get both good mask fit and keep the mask secure. I hope this introduction gives you a basic idea of the different styles of mask interfaces available for use for PAP therapy. On behalf of the Pacific Sleep Program team, we wish you a good night, sleep well,